Good afternoon. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you for being here today. Today we'll be providing an update on guidance to best use COVID-19 testing options here in Santa Clara County. Today we have Dr. Sarah Cody, who is our health officer and director of the public health department here in Santa Clara County, and we also have James Williams, our county counsel. We'll start this press conference in English. We will then take questions from the media. After that, we will move into statements in Spanish, Chinese, Vietnamese, and Tagalog from the podium. Without any further ado, I welcome Dr. Sarah Cody.
Good morning or good afternoon. I wanted to give first a little bit of context about where we are in the pandemic locally before I talk more specifically about current testing recommendations. So today, we are just actually 9 days short of marking the 2-year anniversary of when we started formally responding to the pandemic here in Santa Clara County. So we are closing in on our 2-year anniversary. And we are still in the throes of the highest infection rates that we have seen to date during this entire 2 years. We have learned that Omicron spreads like wildfire. And we know that many sectors, including healthcare, education, and many other critical sectors, are experiencing a lot of staff shortages because of illness from Omicron. And we also know that there's a lot of change, a lot of fatigue, and a lot to keep up with. But I do want to offer a glimmer of hope. And that hope comes from our sewage surveillance. So you will remember that when I spoke in December, that was our first indication that we had a problem with Omicron. This is a surveillance system that we track and follow quite closely along with others. And we are now seeing some signs that increasingly make me feel confident that the levels of infection are just starting to come down. What we are seeing is that all 4 sewer sheds that we track in our county are showing a decrease in the amount of Omicron detected. We're by far from out of the woods. What I'm saying is maybe we're starting to approach where we were 2 weeks ago, but at least we're not continuing to rise up. As far as hospitalizations, that's quite a different story. Our hospitalizations are continuing to increase, and we anticipate that that will be the trend for a little bit more because hospitalizations lag the increases in infections. But at least I wanted to just give that little bit of light. We know that there is light ahead. So that's really the context for the comments that I'm going to make about testing. We've always said, and we know now more than ever, that we have to put these layers of protection together. And when we have a shortage of one layer, as we do currently with testing, we have to double up on those other layers and really focus on them. We still have fantastic masks of great quality in enormous quantity. We can use those. We still have lots of vaccination and boosters for anyone who's not up to date, and many other layers. But let's talk a little bit about testing. So we know that in our community, as in many places across the country, our current demand far exceeds the supply of tests that we have. And so that is the spirit for the guidance that we're providing about, so when should you get tested, and when should you use which kind of test? So just a few key points. First, when should you use an antigen test? Those are the ones that you can buy over the counter. Those tests are best used to, quote, test out early from isolation. So if you already know you have COVID and you're just wondering, when am I no longer infectious? When am I no longer a risk to others? An antigen test is the best test to use there. Similarly, if you've already had COVID in the last 90 days, and you get and you need to test again, an antigen test is the best to use. And the reason why this is the other test, the PCR test, is so good at picking up virus, even little pieces of dead virus, that it's going to test long after you're infectious to others. And that's why an antigen test is sometimes the best test to use. So when should you use a PCR? The PCR is still the optimal test if you have been exposed to somebody and you're wondering whether you're going to develop the infection. However, an antigen test can also be used for that as well. A couple other things I just want to note that are super important no matter what. If you have symptoms of COVID, isolate yourself right away. If you have symptoms, isolate yourself right away. We know how prevalent COVID is, and so that's the most important step you should take. And you can use either test to figure out if you have COVID. And finally, and this is really important, please do not use emergency rooms as testing centers. Emergency rooms are there for people who require emergency care. We urge everyone who needs tests to access tests somewhere other than the emergency department. So I just want to return before I close to those layers of protection and emphasize again, testing is an important layer, but because right now, and by the way, we don't expect this situation to last for that much longer, but because right now you can't get a test at a moment's notice, we're issuing guidance about when it's really important to test. And we want to remind you that there are many other layers and ways to protect yourself: masking, vaccination, ventilation, avoiding gatherings, staying home when you're ill, etc. So thank you very much. And I think James Williams, our County Counsel, is just going to offer a few comments before we open it up to questions. Thank you.
Thank you, Dr. Cody. Good afternoon. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Just wanted to take this opportunity, since we're talking about testing, to remind everyone that large healthcare systems are still subject to the health officer's September 16th, 2020 order regarding testing. What that means is that if you are symptomatic or you're a close contact and you're a patient of any of the large healthcare systems here in Santa Clara County, you have a right to a test. You have a right to a test immediately if you present, or within 1 day if you call to schedule a test. That's still in place under that health order. And if you're having issues or challenges, and we know that people are, you can visit sccovidconcerns.org. That's sccovidconcerns.org, so that we can then get that information and take appropriate responsive action with the large healthcare systems. Testing's been a challenge throughout the pandemic. That's why that testing order was put in place. And we really do need all of the large healthcare systems in the county to do their part so that the burden isn't solely on the county itself, which is currently providing a disproportionate percentage of the testing to our community. Thank you.
All right, we will now take questions from the media. We'll start from this side. If you can please identify yourself and the outlet that you're with. We'll start over here.
Sure. So the question was about the responsive action that we might take if there are issues with compliance with the testing order, and my reaction kind of to what's going on with the healthcare systems and the testing availability. The short answer is this is a health order. We have in the past taken enforcement with respect to the testing order. We're prepared to do so again if needed. But we do need to know what's happening, and that's why I put out there the sccovidconcerns.org portal, so that if we're getting situations where people are presenting and they're unable to get a test and they qualify under that order, we then find out so that we can follow up. We haven't been getting those complaints through the portal to date. And that makes it really hard for us to take that follow-up action. Now, the data is pretty clear that the large systems are not proportionately providing the testing, but we really need that individual information from folks who are having challenges. So I encourage people who are to visit that portal, provide us with that information so that we can follow up. You know, the other thing I would say is it is absolutely critical for this to be an all-of-community effort. And one piece of that absolutely is the role of our large healthcare systems to provide vaccinations, to provide testing. Unfortunately, and this is very clear in the data, unfortunately, the county itself has had to provide disproportionate access for vaccination and testing far greater than the number of people in our community who rely on the county health system for their primary care. Vaccinations, that's basic primary care. That's where we go to get our tetanus booster. That's where our kids go to get their basic vaccinations. That's where we go to get our flu shots. COVID vaccines are part of that basic primary care. The same is true for this diagnostic COVID testing. People should be able to get that access from their primary care provider. That should be the first place that they can go. In our community, people are going first to the county health system. We're glad that the county health system has been able to provide that service to the community, but it is not reasonable for the county health system to provide such a disproportionate share of the testing and vaccinations. We absolutely need the other large systems like PAMF, like Kaiser, and others to step up and do their part as well. Absolutely putting them on notice, and violations of the health order are absolutely subject to the same civil enforcement as all the other health orders.
Who do we have over here?
You said you don't expect some relief in the testing shortage in the near future. Do you have a timeline for that? Are you getting tests from the state government? Like, when do you think that will start to happen?
There are a lot of tests in the pipeline, antigen tests, both from the federal and the state government. And I don't have an exact timeline on that, but I would say, in the nearish future, we may see a softening of the supply crisis. It's far too early. I want to emphasize, I want to do two things. One, I want to provide a glimmer of hope to the community that this isn't going to go on forever and ever and ever, this surge that we're in right now, which is why I wanted to make sure you all understand what the sewage surveillance looks like. But at the moment, we are still in the middle of the greatest surge that we've had during the entire 2-year pandemic, and every layer of protection is incredibly important for two reasons. One, helps to protect ourselves, and equally important, it helps to protect our community and bring us through this crisis as quickly as possible. So really the focus right now is continuing to practice those layers of protection and to focus on the ones that we can control. So if there's one that we can't control, for example, testing, we do our best. And then we really focus on the ones that we can control. Thanks. What we know is that across our county, emergency departments are seeing a very large number of people coming in seeking care and requiring care. While I don't know the exact proportion that are there solely for testing, I simply know that the emergency departments are very full, and I want to make sure that everyone knows that that's not the right place to go for testing. It's the right place to go for emergency care.
Sure. So the question was, what type of situation would we want reported to the sccovidconcerns.org portal? And what we're looking for are if there are suspected violations of that September 2020 testing order. What does that mean? That means if you are symptomatic or a close contact and you have tried to get access to testing from your healthcare provider, but we're told it's not available for a week, or we're told to go somewhere else, or we're directed, for example, to the county health system, those would be violations. Those would be the exact kinds of things that we'd like to hear about. Again, if you're symptomatic or a close contact.
You mentioned that the county is taking a disproportionate run of the testing. Do you have figures, approximately of how much percentage of testing that the county is doing right now compared to the
Sure. So the question is some data around what's happening with the testing. So the county health system has about 300,000 residents that get their primary care from the county health system's clinics, but that's about 15% of the county population and has been providing over 20% of the testing. By contrast, for example, Kaiser is the primary care provider for about 600,000 county residents. That's over 30% of the county population. They've been providing around 12% of the testing. PAMF, which is part of Sutter Health, a very large health system, has about 16.5% of county residents that it is responsible for primary care, but has been only providing 2.4% of the testing. That's what I'm referring to when I'm saying disproportionate. We would expect primary care systems to be providing access to these basic primary care services.
Right. This is a question with regards to schools and testing in schools. I have just two thoughts to offer. One is the importance of in-person learning for all students. 2 years into the pandemic, we do know that our children have suffered academic learning loss, extraordinary mental health challenges, social isolation, etc. So we know that the harms of not being in school are fairly great. For most students, and there are some students for whom the risk of COVID is still quite significant because of an underlying health condition, but for most students, the balance certainly weighs in favor of being in school. We also know that there's so much COVID circulating in the community that everyone has a risk of exposure in the classroom, on the campus, in the community, at home, after school, et cetera, et cetera, et cetera. So it's getting increasingly difficult to pick out which is which. I think that there's been new guidance to schools from the state, and it takes a different tact. So rather than tracing each individual child, it's more thinking about exposure in the classroom or even indeed in the school. Our recommendation thus is simply that kids get frequent, regular testing. We understand that there are challenges in getting antigen tests into some schools not. The state has been sending lots of tests directly to schools, and we are also in contact with schools. So important that tests are available to schools. It's not perfect. We are all working together to ensure that the supply is as good as it can be to keep our kids in school.
The mayor of San Jose and the city want people to go to a drug campuses and get tested before they come in. We're talking 16,000, 18,000 people. What's your guidance?
Right now, where we are in the pandemic, where we are still in the middle of a surge, our general recommendation, not a mandate, but our recommendation is to avoid large gatherings. While there are layers of safety that can be put into place, masking, testing, vaccination, boosting, that will help a lot. There are just probabilities at work, and I would avoid large gatherings. That would be my recommendation, not a mandate, but my recommendation.
He's asking those people, those fans to test before they come in. We're talking 60,000 fans, 60,000 tests.
Yeah, it's also a challenge, so that is an option for those people, given that our community at this moment in time does not have a massive supply of tests. That might not be the best way to use the limited tests that we have.
I have a two-part question. The first part is, when a patient goes to the ER to get testing, can they be turned away under your policy, the health order, your policy? And is there anything that the county can do at this point to prevent that, as you encourage people to not go to the ER just for the test?
Our job at the county in public health is to communicate clearly to the public when to use which resources and what to do. And our clear message to the public is, if what you need is a test, go to secfreetest.org and look for a test. If what you need is emergency care because you're very ill, go to the emergency department.
All right, we'll take one last question over here.
You were talking about hospitalization still being a concern. Can you talk about who you're seeing being hospitalized still? Are those more unvaccinated people with underlying medical conditions here?
The question is around who are being hospitalized, who's being hospitalized. We have looked closely at rates. So we look at hospitalization rates by vaccination status, and it is very clear that the rates of hospitalization among people who are not vaccinated are much, much higher than the rates among those who are. And among those who are vaccinated, the rate among those who are vaccinated but not boosted is higher than those who are boosted. Two other things to remember about our hospitals is it's not just that people are being hospitalized because they're ill with COVID and need COVID care. There are a lot of people that are being hospitalized for something else and test positive. But both have a significant impact on our healthcare delivery system because they require extra care with isolation and infection control.
I just wanted to add one other thing. I was asked earlier about the testing data, and obviously this conversation this afternoon is focused on testing, but I did want to note we're seeing the same disproportionality issues in vaccination delivery. And if folks are interested in that data, county health system, again, 15% of the residents get primary care from the county health system. County health system has provided over 37% of the vaccination doses administered. Kaiser, 31% of residents get primary care, only 14.8% of vaccine doses delivered. And PAMF Sutter Health, 16.5% of residents get their primary care, and only 3.5% of vaccine doses delivered. So very similar situation there as well, in case that's relevant for all of you. Thank you.
Before you go, do you have time to say a few words about Wordsmith for the time today?
I have no comment on that. Thank you.
All right, we're now going to go ahead and move over to the Vietnamese portion of the press conference.
Kính thưa quý vị, hôm nay hạt Santa Clara có buổi họp báo để đưa ra các hướng dẫn của Sở Y tế Công cộng của quận hạt về việc xét nghiệm, khi nào thì cần đi xét nghiệm và khi nào thì không cần đi xét nghiệm. Quý vị nên xét nghiệm COVID-19 ngay nếu có các triệu chứng mới như là mỏi mệt, nhức đầu, đau nhức trong mình, đau nhức cơ bắp, ho, sốt cao, đau cổ họng hoặc là bị nghẹt mũi. Điều này càng quan trọng hơn nữa và cấp thiết hơn nữa nếu quý vị có nhiều rủi ro bị nhiễm bệnh nặng hơn là vì tình trạng sức khỏe, tuổi tác hoặc hiện đang có hệ miễn dịch bị suy yếu. Quý vị có thể hội đủ điều kiện để được điều trị sớm hơn, tránh tình trạng bị bệnh nặng. Quý vị nên tính đến việc xét nghiệm nếu có tiếp xúc với người đã nhiễm Covid trong vòng từ 2 đến 5 ngày vừa qua, nhất là khi quý vị chưa có tiêm ngừa hoặc là đang có triệu chứng. Nếu quý vị có những triệu chứng và không thể tự đi xét nghiệm thì cứ xem như là mình đã nhiễm Covid-19 và hãy tuân theo các hướng dẫn cô lập. Đồng thời, nếu người trong nhà cũng có những triệu chứng của Covid và ít nhất một người đã có kết quả xét nghiệm dương tính thì quý vị có thể xem như tất cả mọi người trong nhà đều đã nhiễm Covid-19 vì biến thể Omicron đang lây lan rất nhanh. Quý vị không cần xét nghiệm lại với xét nghiệm PCR nếu đã có kết quả xét nghiệm dương tính khi tự xét nghiệm ở nhà. Nên tự xem là mình đã có nhiễm Covid và cô lập ngay. Quý vị cũng không cần xét nghiệm nếu đã có kết quả xét nghiệm dương tính trong vòng 90 ngày vừa qua, trừ khi có thêm những triệu chứng mới hoặc là bị bắt buộc phải cách ly. Nếu phải xét nghiệm, chỉ cần sử dụng xét nghiệm nhanh, kháng nguyên ở nhà. Ngoài ra, có một vài điều cần lưu ý về việc xét nghiệm. Phòng cấp cứu chỉ dành cho các bệnh nhân bị bệnh nặng cần chăm sóc khẩn cấp, không phải là một địa điểm để xét nghiệm Covid-19. Xin vui lòng đừng đến phòng cấp cứu nếu chỉ cần được xét nghiệm Covid-19 mà thôi, trong khi quý vị không hề có một triệu chứng nào. Nếu quý vị có những triệu chứng khó thở hoặc các triệu chứng nghiêm trọng khác, xin hãy liên lạc với bác sĩ ngay lập tức. Và theo lệnh y tế ngày 16 tháng 9 năm 2020, thì những hệ thống y tế lớn bắt buộc phải xét nghiệm ngay cho quý vị nếu quý vị không có triệu chứng hoặc là đã tiếp xúc với người đã nhiễm Covid-19. Tuy nhiên, xin quý vị nhớ là cái phòng cấp cứu chỉ dành cho những trường hợp thật sự cấp cứu và những người cần đến mà thôi. Phòng cấp cứu không phải để dành cho xét nghiệm Covid. Và xin quý vị hãy lên trang fccfreetest.org để tìm những địa điểm thuận tiện cho mình. Ngoài ra, bắt đầu từ ngày 15 tháng Giêng, tất cả những hệ thống y tế sẽ phải trả tiền chi phí cho 8 bộ xét nghiệm Covid ở nhà hàng tháng. Và một kết quả khi mà quý vị xét nghiệm kháng nguyên bị dương tính thì cứ xem như đó là kết quả thật rồi và không có cần phải xét nghiệm PCR thêm. Quý vị có thể mua những bộ xét nghiệm này qua các hiệu thuốc Tây, nhiều những cái tiệm khác trong địa phương và có thể lên mạng để tìm mua những bộ xét nghiệm này. Và những cơ sở, những trường học và những nơi giữ trẻ được khuyến khích phải chấp nhận kết quả của những bộ xét nghiệm ở nhà để mọi người không phải đến những địa điểm xét nghiệm và dùng những cái phương tiện mà có thể người khác sẽ cần dùng. Chúng tôi là Như Hạnh, xin cảm ơn quý vị. Và tiếp theo,
Muy buenas tardes. Mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el Condado de Santa Clara. Esta mañana los funcionarios de salud pública, la doctora Sara Cody, acaba de proporcionar un update con respecto a dónde estamos con esta pandemia aquí en el Condado de Santa Clara. Como sabemos, esta esta reciente ola de casos de COVID-19 ha sido una de las olas más altas que hemos tenido durante la historia de esta pandemia. Mas, sin embargo, en las aguas residuales de aquí del condado de Santa Clara estamos viendo las primeras señales en donde estamos notando que la detección de la nueva variante Omicron está empezando a disminuir, lo cual nos está dando muy buenas esperanzas. Mas, sin embargo, en la otra cara de la moneda estamos viendo también que las hospitalizaciones siguen aumentando. Estamos viendo más hospitalizaciones día a día, al igual que con personas quienes están yendo a los hospitales con COVID y también personas quienes están yendo por otras situaciones, pero se les ha hecho la prueba en los hospitales y han salido positivas al COVID-19. Es muy importante también reconocer, o también el día de hoy también se habló acerca de la gran demanda que existe en el condado de Santa Clara al nivel nacional también acerca de las pruebas de COVID-19. Ahora, estas pruebas de detección de COVID-19 comúnmente se han estado ofreciendo en todo el condado a través de nuestros sitios de pruebas que tenemos en nuestro sitio web, el cual es sccfreetest.org. Mas, sin embargo, queremos hacerles saber que la opción de las pruebas, existen dos pruebas en la actualidad que estamos promoviendo. La primera es la opción de la prueba PCR, la cual generalmente es administrada en una clínica o en los centros de operación del condado que son de autoservicio. Y una prueba de antígenos que también está disponible para uso domésticos. Estas pruebas de antígenos son conocidas también como pruebas rápidas o pruebas caseras. Ahora, el condado recomienda que las pruebas de antígenos se utilicen con el propósito de acortar los periodos de aislamiento. Es decir, cuando una persona ya se aisló o terminó su cuarentena por 5 días y que tiene que tener un resultado negativo, puede utilizar una prueba de antígeno o una prueba casera. Ahora también, para aquellas personas quienes han dado positivo a COVID-19 en los últimos 90 días y que han empezado otra vez a mostrar síntomas, estas personas también pueden utilizar estas pruebas de antígeno. Los resultados de la prueba de antígeno deben ser reconocidos como válidos. No hay necesidad de una prueba PCR de seguimiento con un centro de atención médica o del condado. Además, las personas que necesitan estas pruebas para regresar al trabajo o para regresar a la escuela pueden utilizar las pruebas de antígeno, quieren decir las pruebas caseras o las pruebas rápidas. También se les recuerda que, por favor, si usted solamente necesita irse a hacer una prueba, no vaya a los cuartos de emergencia a hacerse las pruebas. En la actualidad estamos viendo un alto número de personas que están yendo a los cuartos de emergencia solamente para obtener una prueba de COVID-19, lo cual limita la capacidad que podríamos proporcionar a las emergencias o a aquellas personas que realmente necesitan urgente médico, cuidado médico urgentemente. También se les recuerda a la comunidad que en estos momentos, si empiezan a mostrar síntomas de COVID-19 o si dieron positivo recientemente a COVID-19, que se pongan en aislamiento lo más pronto posible, y esto quiere decir que por al menos 5 días estén aislados. También, debido a la alta demanda de COVID-19, de las pruebas de detección de COVID-19, si una persona vive con más miembros de su familia bajo el mismo techo y esta persona dio positivo, es mejor asumir que todos en esta casa tienen el COVID-19 y tienen que guardar el aislamiento o la cuarentena. Ahora, las personas que se deben de hacer las pruebas de detención de COVID-19 son aquellas personas que están mostrando síntomas y también aquellas personas quienes están a alto riesgo debido a una condición médica o a su edad. También puede considerar hacerse la prueba si han pasado de 2 a 5 días después de que ha sido notificado que ha sido expuesto a alguien que tiene COVID-19. Ahora, no debe de hacerse la prueba si ya dio positivo mediante una prueba casera o una prueba de antígeno. Suponga que tiene COVID-19 y aíslese lo más pronto posible. ¿Dónde hacerse la prueba? En estos momentos tenemos diferentes sitios a través del condado en los cuales la gente puede visitar para hacer una cita, y también hay lugares que no se requiere cita, más sin embargo las líneas de esperas son muy altas. Pueden visitar nuestro sitio web, el cual es sccfreetest.org. Ahí tendrán también la versión en español. Y por último, solamente para recordarles que mientras las pruebas de COVID-19 están en muy alta demanda, en estos momentos también tenemos otras herramientas que ya sabemos y que conocemos para que sigamos usando. Estas herramientas incluyen el uso correcto de nuestra mascarilla, también asegurarnos que haya ventilación en los lugares cerrados en donde estemos, al igual que minimizar el contacto que tenemos con otras personas donde no sabemos su estatus de vacunación, y también en estos momentos es recomendable que también se eviten las reuniones en magnitudes. Muchísimas gracias, and we will now go ahead and transition to Tagalog.
Magandang umaga mga kababayan. Ako po ay si Jimbel Batuampo, Public Information Officer ng Santa Clara County. Ang pampublikong pangkalusugan ng County ng Santa Clara ay nag-aalok ng mga patnubay upang pinakamahusay na gamitin ang mga opsyon sa COVID-19 testing. Ito ang mga sumusunod. Kayo ay dapat magpasuri kung meron kayong mga bagong sintomas na maaaring mga hulugan na kayo ay may COVID, gaya ng pagkapagod, pananakit ng ulo, pananakit ng kalamnan o katawan, ubo, lagnat, pananakit ng lalamunan at iba pa. Ang inyong mga bagong sintomas ay lalong mahalaga kung kayo ay nasa mataas na panganib ng malubhang sakit mula sa COVID. Dahil sa iba pang mga medikal na kondisyon, mas matandang edad o pagkaroon ng compromised immune system, dahil maaari kayong maging kwalipikado para sa paggamot para mabawasan ang inyong panganib sa malubhang sakit. Dapat niyong isaalang-alang ang pagpapasuri kung 2 hanggang 5 araw na ang nakaraan pagkatapos ng inyong napag-alamang pagkakalantad sa taong may COVID, lalo na kung kayo ay hindi nabakunahan o may mga sintomas. Kung kayo ay may mga sintomas ng COVID at hindi makapagpasuri, ipalagay na kayo ay may COVID at sundin ang mga patnubay sa pagbubukod. At saka kung ang mga membro ng inyong sambahayan ay may parehong sintomas at hindi bababa sa isa sa kanila ay nasuring positibo sa COVID, maaari niyong ipalagay na ang lahat ng membro ay may COVID dahil sa kung gaanong masyadong nakakahawa ang Omicron variant. Huwag magpasuri kung nasuri na kayong positibo sa pamamagitan ng home o antigen test. Huwag magpasuri muli sa pamamagitan ng PCR. Ipalagay niyo na kayo ay may COVID at magbukod ng naaayon. Huwag magpasuri kung nasuri kayong positibo sa huling 70 araw. Huwag magpasuri muli maliban kung may bago kayong mga sintomas o kinakailangan mag-quarantina. Kung magpapasuri kayo, gamitin ang home antigen test. Iba pang mga mahalagang tandaan tungkol sa pagpapasuri. Ang emergency room ay para lamang sa mga pasyente na may malubhang sakit at nangangailangan ng emergency na pangangalaga. Ito ay hindi para sa COVID testing. Kung kayo ay nahihirapan sa paghinga o may iba pang malubhang sintomas, mangyaring maghanap ng pangangalaga kaagad. Ang impormasyon hinggil sa pagpapasuri para sa COVID-19 ay makikita sa sccfreetest.org. Maraming salamat.